She's pastor at Compass Church. Her name is Jennifer Long. They have an initiative called the UNDUE Medical Debt Initiative. We'll explain. Hi, Jennifer.
Hi there.
How are you doing?
I'm doing great this morning.
Excellent. Thanks for being on.
Thanks.
This initiative, is this nationwide or is this something we're doing here?
This is something that we are doing as a part of Compass, and we are able to really pinpoint areas right around the Cape Girardeau area, 28 counties in the Cape Girardeau area, but then it will also take effect statewide for any funds that are over and above that are needed in this area.
And they're a 501c3, so bear that in mind. So undue medical debt, and I thought, well, if it's not due, why is it a problem? But what do you mean by that?
Right. So it's UNDUE, UNDUE. So we are helping people who have medical debt, which we know thousands and thousands of Americans have medical debt. It's actually the number one cause for bankruptcy in our country. And so we get to help cancel those debts, undo those debts that are due.
Okay. So what are you doing to raise that money?
So undue medical debt buys up portfolios of debt from third parties or directly, in some cases, directly from hospitals and physicians. And we can raise all of that money then, rather than going and collecting it from people, those debts from the people, they actually ask donors to help pay those debts. And so what we're doing is we're having an initiative that we can help our community, our church and our community all come together, and we can raise $15,000, and that will cover, get this, $2.3 million in medical debt.
How? That's a big gap.
I know. Isn't that crazy? Well, I do think it goes to show a little bit of the brokenness of the system. But so debt can be bought up for pennies on the dollar. And for our particular case, and I don't want to get over my skis on all of that. I'm not exactly sure how all that works. But for our case and the debt that they have been able to purchase in Missouri, it's more than just, 1 to 100. Actually, $1 can help cover and cancel the debt of $153. So a little bit goes a long way.
Well, and I identify with this because, I've needed a scan for a long, long time, and I won't go get one because I don't have medical insurance. I do have concierge, and it's wonderful, but that doesn't cover scans and the big stuff. And so people put it off, they prolong it, they do whatever they got to do, but when you don't have the money, you don't do it.
Right. And one of the things about undue medical debt is they aren't just helping to pay off those debts. They're also looking at the systems and kind of the ways that they can come alongside and advocate for people, because that is a huge concern. People really do. They delay care, or they just don't go at all and end up in emergency situations that often also cost more.
Yeah. My daddy was always of the mind, if I don't know about it, it can't get me. And it got him.
Unfortunately.
Yeah. It got him at 74, and I wish I'd have had him a lot longer. But, he had health insurance. He just didn't want to go.
Right.
He was a guy. You know how it is. But there are a lot of people who are just scared to go to the doctor, too. So that's something you need to get over, because doctors are not scary. But how are you going about making sure how are you picking the people that you're helping?
Yeah, so we don't actually get to pick the people, and actually neither does undue medical debt. It's whatever debt gets bought up in these portfolios. But what we can do is we can target particular areas. We can go by county. And so we chose 28 counties in southeast Missouri, western Kentucky, and southern Illinois. Most of those, I think 18 of them are Missouri counties. And those debts that get bought up in that area will be the ones that we are able to cancel and to forgive. And so it's really awesome to be able to target and to know that we're helping our community and being very, very community minded. And anything beyond that then also can go to Missouri as a state. They have about $15 million worth of debt in Missouri. currently that they're holding to raise funds for.
Right. And this is not kind of the people who are on Medicaid and Medicare who are getting free health care anyway. These are the people who are falling through the cracks.
Yes, these are people who they can make 4 times below the poverty level. So, like, say a family of 4, the poverty level, 30,000. Then if they make 120,000 or less, then their debt could be bought up in one of these portfolios. The other criteria is if their debt is 5% or more of their annual income. So that's kind of the criteria that they use for which debts are bought up. So we can't, there's not a place to go and apply to have your debt, forgiven or anything. But the people that do qualify, and those debts that do qualify, they'll get a letter in the mail after we have done our campaign and we've gotten it all. But they'll get a letter in the mail that says that their debt has been forgiven.
Can't imagine. That'd be a party. Someone's having a party. All right, so I have a minute left. How do people get involved?
So they can go to our website for Compass Church. It's compasscg.org, so Compass Cape Girardeau, and then /UNDUE, UNDUE. And we've got all the information there. We've got links to giving, and really, a dollar that can make a difference. And if all of us, if we give just $1, we can experience the impact that dollar can have when we do good, together. This is a community thing. $100 can pay off $15,000. So you can also see information about UNDUE debt there and their FAQs and some things like that. So, yeah, would love to have more of our community involved. We've already raised over half of it, so we're very excited. Mm-hmm. We've got a few thousand more.
All right. It's called Compass /UNDUE. And compasscg.org/UNDUE.
Sorry,
I'm looking right at it, and I didn't even say the CG. Compass CG /UNDUE, UNDUE, if you want to help with the Medical Debt Initiative. She is Pastor Jennifer Long. Thank you, ma'am.
Thank you.
What a nice thing to do. I appreciate you.
Thank you.
Bye-bye.